Question 69. Which of the following is the most appropriate next step? Administer treatment due to life-threatening nature, seek permission, honor the patient's decision, refer to the case. Okay, hospital ethics committee. This one is always wrong. I'm just going to cross that one off right now. So welcome back. We've got another ethics question. Ka-chow, this should be time saving. You're going to be saving time like Lightning McQueen. You're going to be fast on these. Okay, so if it's most appropriate next step, and I'm seeing things like administer the treatment versus honor the patient's decision. First off, it's probably always honor the patient's decision. Most times, I would say it's honor the patient's decision, but we have to decide if they have capacity first. So let's read through this and just make sure. Okay, 58-year-old COPD, oxygen situation improves with supplemental oxygen, declines antibiotics and bronchodilators. The physician discusses the risks, including respiratory failure and death. The patient acknowledges the risks and repeats back the information clearly. It's important. He says, I understand what might happen. I'm just done fighting the disease. So long as your patient is alert and oriented, they understand the risks, are able to repeat it back to you is a good way to prove that they understand the risk, that they heard what you said in the first place. So long as they're all mentally there, mentally sound, then they have the permission to refuse life-saving treatment. That's their prerogative. That's called capacity in this situation. We were assessing to see if the patient has medical capacity, decision-making capacity. They didn't say he's delirious. They didn't tell us he has dementia. He's not manic, having a manic episode, something like that. Any of those would exclude him from having capacity in that situation. But here, really nothing wrong. He's just done fighting the disease. He repeated everything back, so he's good. Therefore, honor the patient's decision. Choice C. Like I said, most of these questions are going to be honor the patient's decision, but always double check that they have capacity.